I'm Eunice from Makueni County. I'm 38 years with the 2 kids, a girl and a boy. I'm married with 1 husband. I'm also a HIV positive. When I came to Makueni referral, I was diagnosed that the doctor told me that I have a TB, which is not the normal TB, but there were a TB that resists some drugs. After I was told that I have TB, immediately the nurses started me the clinic for TB. I started taking drugs immediately the first week after I was diagnosed.
So the gene expert is the one which tells us whether the patient is just a normal TB or has drug-resistant TB. Once the machine picks rifampicin resistance, then that is the starting point. We record that patient as an MDR. Then we take sputum for culture and sensitivity to confirm whether there is any more of the other drugs resistance. Apart from gene expert, we do chest X-ray, we do full hemogram, we do many other tests.
Every morning, around 13 tabs, every morning. I was so much surprised, taking. Even my family was worried. For the first 2 weeks, after I take the drugs, I was only sleeping. My body was weak, I could not move. I spent all my time sleeping. Even walking was a challenge to me.
When we diagnose an MDR-TB, that is multidrug-TB patient, the first thing, of course, we do counseling. These are treatments that takes a very long duration with a high pill burden treatment, because the patient has to take so many pills because they're in single dosages. Unlike the treatment of new patients where the drugs are in a combined fixed dose combinations. But in multidrug TB, the drugs are in single dosages. So you find that the patient is taking so many pills. We have to do good adherence counseling. We have to tell the patient the number of drugs the patient will be taking, the duration of treatment, the various side effects the patient should expect, and the investigation that we shall be doing.
I was advised by the nurse who gave me the drugs to be using porridge. So after that, after I started taking the drugs with porridge, now they become friendly to my body. I was swallowing them as if there is nothing. To me, this is a challenge for taking similar drug for 18 months. If they can make another type that you can take only for 6 months, it will be better. Even though I have gone through, I'm almost to complete my 18 months. Those months are very many. Most people may think they can also stop taking the drugs because it has a long duration.
So you can imagine taking all those drugs for 18 months. It is really hectic. It is hell of time. The side effects, the nausea, the gastric side effects, diarrhea, vomiting. So if the government can afford the newest drugs in the market and shorten the regime, I think it will improve on adherence to the patient and also reduce on the side effects.